Whenever you or a loved one suffers from a condition of stress, fatigue, pain, or illness, traditionally we are prescribed some sort of drug. Unfortunately, we have been conditioned by so many commercials on TV today that you should ask your doctor about a specific drug to treat your symptoms or condition. Yet drugs do not and cannot cure you. In order to cure or heal a health condition, you need to correct the problem at its source. So what do drugs do, you ask? Well, they provide temporary relief, not a cure to the problem. If you continually take a medication for an extended period of time, your body compensates for this drug, which is why your dosage must be adjusted to continue to receive the temporary relief. Let's face facts. If the prescription you are taking was due to a deficiency of that substance in your body, don't you think you would have been cured by now? Welcome to this special report. My name is Bud Hettinger. As a journalist for more than 30 years and a former TV news anchor, I'm about to share with you a medical breakthrough that could literally change your life or that of a loved one. Together, we are about to embark on an educational journey through health and wellness that will provide you with a newfound understanding of your body. If you know someone suffering with arm, leg, back, or neck pain, I want you to pick up the phone right now and call them and tell them to tune into this program. It could literally change their life, because over the next 30 minutes, we're going to learn of a medical breakthrough which does not involve drugs, does not require risky surgery, does not involve difficult exercises, has proven to be safe and virtually painless, and is clinically proven to be extremely effective for thousands of people. We're going to explore these amazing advances in medical technology and meet some folks who have phenomenal stories to tell about how this medical breakthrough has relieved their pain, enabled their bodies to heal, and most importantly, has given them their life back. Let's meet one of those people right now.
I had to go to an orthopedist. So I went to see him and I was diagnosed then with 2 new herniated discs. At that point in time, they gave me some options and some things that I could do. One of them was to just learn to live with it. Pick the things out of your life that hurt too much or it's not worth it anymore, and just stop doing them. So there was a whole list of things that I was unable to do anymore. I was getting ready to give up just because it was so painful. I could have another surgery. They said, you're eligible right now for another surgery. And I thought about it and I thought, well, that's probably another $30,000 or more, probably another surgical rehab. Always, again, running a risk that something goes wrong in surgery and you never wake up again. So none of those options looked really good to me at all. But it was then that someone told me about another option that I was unaware of, and that was the spinal decompression. It was easy to see amidst all of my options that that was the best one for long-term health. After the 4th session, I think it was, during the first week of treatment, I had sort of a breakthrough moment, and I remember standing there thinking, you know, this is the first time that I'm standing here pain-free. I'm not feeling any pain at all. It had been months since I had a moment without pain. I was able to start playing golf again regularly. That list that I made of things that I was not able to do anymore, I still have the list, and I look at it from time to time and I realize that instead of looking at it and feel sorry for myself, I look at it and smile because I'm all better.
In order for the human body to function pain-free, it is absolutely essential that your nervous system be healthy and functioning properly. Therefore, it is necessary to keep our spine properly aligned so that it does not interfere with those communications from our nervous system. Misalignment of your spine is what health professionals call subluxation. Perhaps you were in an accident, or you're just one of those people who pushes life to its limits. Maybe you're just getting to that age of experiencing daily pain, possibly from a previous trauma or injury that may have happened many years ago. Chances are you probably have a subluxation right now and aren't even aware of it. Subluxation is the #1 cause of your nervous system's inability to pass these communications from your brain to your body, thus causing the inability of your body to properly function and heal itself. Subluxation is a common condition that has been treated naturally by chiropractors since the 1800s. The medical community has closely duplicated that effect, developing a wonderfully beneficial medical breakthrough therapy treatment that uses no drugs, no surgery, no needles, and is completely safe and, in the vast majority of cases, completely pain-free, allowing the human body to heal itself naturally from the inside out as nature intended. It's called spinal decompression. For so many folks suffering with chronic pain, decompression therapy has meant a new lease on life. Watch this.
Finally, one day the pain was so horrible I ended up in the emergency room, and finally the emergency doctor suggested you need to get an MRI, you need to see a specialist. So I went and got an MRI. Hey, you have a herniated disc. Okay, great, now what? You need to see a specialist. Went to the orthopedic specialist. All he wanted to do was cut me open. Surgery was his only option, or pain management, which my definition of pain management, or at least what they told me, basically in so many words is, hey, here's a pill bottle, let me show you how to open it and take the pill. Pain management. And that's really what they were suggesting to me. They were prescribing drugs. I was taking them on a regular basis, and it was not your everyday Advil and Tylenol. We're talking serious painkillers that the only way that they work is when you're passed out sleeping or knocked out and not able to do everyday things. So that was a real problem. Thank God my dad called me and he said, you really need to go see this guy. I think it'll really help you. He's really into the alternative solutions as well. And he has this thing called decompression therapy, and it's got a very, very high success rate. My pain level has gone from a scale of 1 to 10, it was 11, to a 1 or virtually none at all. It's definitely a life-changing experience. It changed my life.
If you're looking for relief from back pain, neck pain, sciatica, herniated or degenerated discs, or a host of other painful conditions, I invite you to call the number on your screen and see for yourself the decompression equipment, how it works, meet face-to-face with people whose lives this incredible technology has helped, and hear how it has changed their lives and the lives of their loved ones. Then you'll be in a better position to decide if this natural, pain-free, non-invasive alternative treatment is right for you.
The decompression therapy for me has been a true miracle.
If you or a loved one suffers from any of these conditions, or if you've ever been told you have to live with the pain, I urge you not to spend another day in pain. Call Dr. Eric Shapiro of Preferred Chiropractic Center now to see if you're eligible for spinal decompression therapy. Call 704-541-4747 to get your free consultation. Decompression technology has given doctors a powerful tool to help their patients, and they're excited about it.
One of the first patients that actually put on decompression was a patient who was not responding to chiropractic treatments. She was getting a little better, but still having a really hard time with just her normal routines, and was really, quite frankly, having a hard time getting on and off the chiropractic table. She was on the decompression therapy for about a period of a month, and it was just shy of miraculous how much better she got. She rated her pain as a 10 out of a possible 10. By the end of that month, she was at a 0 and literally danced a jig for me. She actually did.
I started with my